This article here is by Shibani Matani, so credit to the author for this article. You can see the photo here of this man, flowers and all, and we'd suspect he's off to meet a loved one, maybe a date, or, maybe he's a good guy and they're just for his mom. So here's what the article talks about. China again reported a big jump in coronavirus cases on Friday after changing its methodology for diagnosing and counting infections, denting hopes that the deadly outbreak could be petering out. With another 5,000 cases reported Friday, the number of cases in mainland China has now surged past 63,000 and the economic fallout is mounting. The latest casualties are flower sellers in the country, some of whom have seen their sales fall up to 95% on Valentine's Day. Now, obviously there's a lot more important things, but again, it's Valentine's Day, so what else are they going to talk about? It definitely demonstrates how the impact is on business on a day like today, or even, say, yesterday when people would go out and buy things. It's a microcosm of the economy as a whole. More places in Hubei province, the epicenter of the outbreak, are enacting wartime measures such as sealing off residence complexes and only allowing essential vehicles on the roads. Authorities in Yongmeng County, where the new steps kicked in on Friday, said that anyone attempting to breach the lockdown at compounds, buildings, or road connections would be detained. So here are the latest developments according to the article, and I'm just going to touch on a couple of these in detail, but at least I wanted to share the headlines with you for the ones that I'm not going to talk about. But more cities in Hubei province are putting in place wartime measures, which we just talked about here, barring citizens from leaving their homes, and they've gone as far as threatening penalties for anyone who breaches the orders. And China, we know. I mean, you would think that their citizens kind of, like they have the whip cracked on them and they would know not to defy the orders of the old leadership there. Apps are being used to track citizens who must provide their information before entering and exiting key Chinese cities. This is allowing authorities to collect huge amounts of data. You know, my cynical nature, somewhere Zuckerberg's thinking, how can I get my hands on that app? And just how much data can I get? So, seriously though, Japan has said that 10 people evacuated from the Diamond Princess cruise ship are in serious condition as the cruise industry braces for serious losses over coronavirus fears. I had been thinking about taking a cruise, and there wasn't really anything stopping me just in terms of monetary or anything like that. It was just the timing was never right or what have you. But if you were somebody who was thinking about it at all and was thinking, oh, maybe in the future I'd like to take that European cruise or that Alaskan cruise or the Caribbean cruise, or other cruises depending on where you live, this is something that's definitely going to make you think not only twice, but probably 3, 4, 5 times. Like, I can really see irreparable damage being done because people are going to forever associate cruises with this outbreak on the Diamond Princess if they've been following along. Additionally, China's National Health Commission said more than 1,700 medical workers have been infected with coronavirus, 6 of whom have died, citing the latest available figures as of February 11th. This is one story I wanted to touch on real quick that wasn't in the headlines here, but it says here, Vietnam considers highest penalty for factory making masks from toilet paper. This title intrigued me, so let's read a little bit further on about this. Authorities have found a factory in Hanoi using toilet paper to produce face masks, the Vietnam Express reported, cutting corners as coronavirus fears fuel raising demand for supplies of protective items. Officials this week were suspicious when they found dozens of large toilet paper rolls at the factory, the outlet reported, and discovered that they were being used to replace the inner antibacterial layer that stops microbes from entering and exiting the surgical masks. Can you believe that? Okay. So they give us a stock picture of women in Hanoi wearing masks because we didn't know what those would look like. So thank you for that. I understand you got to take up space and all. This company is cheating consumers amid the novel coronavirus outbreak, said somebody from Hanoi Market Surveillance Department. The company's stock has been confiscated, and authorities are now considering the appropriate penalties. According to the Vietnam Express, the company, Viet Han Company, is not listed as a medical equipment producer, but as a printer and napkin maker. Okay, well, I guess that makes sense. I mean, I guess from their perspective it makes sense. They're sitting around with all these extra supplies and, all it takes is an unscrupulous person in leadership to say, hey, I know a way we can make money off of this, right? And there you have it, masks being made with toilet paper instead of the necessary antimicrobial filter that's needed. The WHO has warned of a global shortage of surgical masks as customers, particularly in Asia, rushed to protect themselves against the spread of the virus. Many factories are now trying to pivot and produce these items, but counterfeits have also flooded the market, with false trademarks and false details on where the masks originated from. And there's something to be said, obviously, about China and the way China operates itself. And this is obviously not to make light of the situation, of course, but it does seem like a precarious situation that you would have now other countries creating these type counterfeit goods. And I definitely understand that China is not the only country who does this, but that China's consumers would now potentially be impacted, or their sick would potentially be impacted by counterfeits from other countries. So it's just something that, if you kind of think about it logically, how would I say it? I would just say it's kind of an interesting development if a lot of these counterfeit masks that don't work actually end up in China. So it says here, more than 1,700 medical workers in China were infected with the virus. Out of Beijing, China's National Health Commission said Friday that at least 1,716 medical staff have contracted coronavirus, and 6 have died. Zhang Zhijin, the director of the National Health Commission, was citing the latest figures available as of February 11th. Of these cases, 1,502 were reported in Hubei province. The Health Commission said that the illness will be identified as an occupational injury for workers who will be covered by insurance. The most sensitive of these cases is the death of Li Wenliang, the whistleblower doctor who is considered to be the first to sound the alarm about the new virus when he leaked a document on December 30th from his hospital confirming the diagnosis. When he succumbed to his disease, grief and rage filled social media as the country saw his death as a parable for the Communist Party's failings. The only thing I would say regarding this would be that, to me, there isn't really a most sensitive case. To me, I consider every death the same. Obviously, we show him a little extra love just because he was the whistleblower, he was the one that came out, and with the way he was treated, hauled off, forced into confinement and everything like that. Obviously, we show him more love for that, but every case is sensitive. Every death is one that matters equally to me. Every sickness, every death, like I said, every person suffering, to me, they're all equally sensitive. So not to take anything away from him, because definitely he was the one that stepped up and did what he did, and we have to be grateful that he did. But to me, I see everybody the same in that regard. The last thing I wanted to cover in this particular article was this here. Japan says 10 people evacuated from the Diamond Princess in serious condition. In Yokohama, Japan's health ministry said on Friday that 10 people evacuated from the quarantine cruise ship, the Diamond Princess, are in serious condition, with 8 confirmed to have the new coronavirus. One of the other 2 is still awaiting results of the test. Amid persistent criticism of its approach, the government said it would start allowing some people who have tested negative for the virus to disembark from the ship early and finish their quarantine at a facility on land. Priority will be given to passengers over the age of 80 and those with existing medical problems, as well as people in windowless cabins, Health Minister Kato said. So far, 218 people on board the ship have tested positive for the virus out of 713 people who have been assessed. The government says it plans to step up testing in a bid to examine everyone on board before the quarantine ends on February 19th. A quarantine officer involved in screening passengers for the virus also fell sick, with the health ministry saying he did not follow proper procedures, wiping away sweat with his gloves and reusing a mask he had worn earlier. That's NHK reporting that. And of course, you know how it is, they're going to want to blame somebody else, right? So unfortunately, this quarantine officer who was out there just trying to help out, he's the one that's going to get his butt kicked here by the health ministry. Unfortunately, he's the one that they're going to try to place the blame on. The health ministry is like, hey, you got it, but it's your fault. So nicely done, guys. Nicely done. Yeah, so that's it for this video. Like I said, there's going to be a second part to it. It's a video that was out of Singapore, and I just found that, like I said, it'd be something that would need its own part. I've talked about the cruise ship issue for a couple days now, and to me, to just be sitting there locked up on that floating metal box, it would just be the worst thing. To me, it seems like the worst possible fate. It seems to me worse than even being locked in your home by far, because you're just sitting here and you're having to go through these screenings every day, and then maybe you're getting rumors, 10 more people pop positive today, 20 more people tested positive tomorrow. You know, if you're seeing outside news reports and you're just kind of sitting there like, what are you doing? Like, I'm trapped on this cruise ship with these individuals. When is it going to be my turn? When's it going to come to me? Because it would feel to me like I'm just waiting for it to be my turn to contract the disease. But anyway, that's the video right there. So let me know what you guys think. Thanks as always for watching. Take care and look out for part 2.